Imagine that a dangerous disease starts spreading from one country to another. Can one country control it completely by working alone? Usually, no. Diseases do not stop at national borders. Therefore, countries must share information, medicines, technology, and most importantly, research. This is the main purpose of the 16th BRICS Health Ministers meeting. India is hosting this meeting in Chandigarh from 22nd July to 24th July 2026. Health ministers and senior officials from BRICS countries are discussing how to make healthcare safer, smarter, and more affordable. Therefore, today's article is not merely about a meeting. It is about how countries can cooperate to protect the health of the billions of the people. I'll ask you a question. Why do countries need to cooperate during a pandemic? Can you answer in the comment section? Next, the meeting happens broadly in three stages. First, senior health officials hold technical discussions. They examine the problems, compare different countries' experiences, and prepare the draft proposals. Second one, health ministers discuss the important political and policy decisions. And third one, the countries may adopt a common declaration. This declaration records what the countries have agreed to do in the future. India's BRICS chairship theme is building for resilience, innovation, cooperation, and sustainability. Here, the word resilience means the ability to continue functioning during a crisis. And the word innovation means finding and using better solutions. And cooperation means countries working together. And most importantly, the sustainability means creating systems that can work successfully for a long time. Here, we'll take one simple example. It is like a school project. Here, teachers and students prepare the details of the project. The principal approves the important decisions. And finally, the school announces the action plan. So, this is how this will happen. A strong health system must be ready before a health emergency begins. First, it must detect the danger early. Disease surveillance works like an alarming system. Genomic sequencing helps scientists understand a virus or bacterium and identify the changes in it. And the second one, the system must respond quickly. Hospitals, doctors, and governments should know what actions to take. And the third one is keep supplies moving, which means essential supplies must remain available. These include medicines, vaccines, oxygen cylinders, testing kits, and protective equipment like that. And the fourth one can see keep normal care running. The regular healthcare services must continue during the emergency time also. Pregnant women still need maternity care. Children still need vaccination. Patients still need dialysis, cancer treatment, and other services. This ability to continue essential services during a crisis is called the health system resilience. Here, there are 7 main priorities of the meeting. The meeting focuses on these 7 major priorities. The first one is pandemic readiness, pandemic preparedness, preparing for future disease outbreaks. And the second one is digital health. So using technology to improve the healthcare. And the third is affordable medicines, making medicines, vaccines, and diagnostic tests available at reasonable prices. The fourth is traditional medicine, scientifically examining safe and useful traditional treatments. And the fifth one is tuberculosis or TB, which remains a major health problem in several BRICS countries. And the sixth one is healthy lifestyles and mental wellness. This includes preventing diabetes, heart disease, and cancer, and improving the mental health care. And the last and seventh one is resilient health systems. Health systems that continue operating during pandemics, natural disasters, and conflicts. So we can remember these priorities under three broad ideas: prepare for emergencies, improve everyday healthcare, and the third one is ensure fair access. Okay, here we can do one thing. Which of these seven priorities is most important for India? Can you explain the reason also? Can you answer this question in our comment section? The next one, let us understand three major areas of cooperation. The first one is pandemic preparedness. Countries can share early warning information, uh, genomic data, and emergency response plans. Early information can prevent a local outbreak from becoming a global crisis. And the second one is digital health. India has developed platforms such as CoWIN, e-Sanjeevani, and the Ayushman Bharat digital mission, like that. So other developing countries can study and adapt these models. And the third one is affordable medicines. BRICS countries can increase local manufacturing, share technology, and purchase medicines together. Pooled procurement means several countries buying medicines together. Because the order is large, they may obtain a lower price. Thus, cooperation helps countries share the knowledge, connect their systems, and reduce the healthcare costs. For example, if 10 students purchase notebooks together, they may negotiate a better price than one student purchasing alone, right? Pooled procurement works in a similar way. Healthcare is not limited to hospitals and medicines. BRICS countries have rich traditions of traditional medicine. India has Ayurveda, Yoga, Unani, Siddha, and homeopathy. China has traditional Chinese medicine, while other members have indigenous healing practices. However, traditional treatments should be integrated into healthcare only after scientific research confirms its safety and effectiveness. Tuberculosis is another major concern. Cooperation can improve diagnosis, treatment, management of drug resistant TB, and research into new vaccines. Countries are also facing a growing burden of non communicable diseases such as diabetes, heart disease, cancer, and respiratory diseases. Mental health has also become an important issue, especially after the psychological effects of the COVID 19 pandemic. Therefore, health policy must cover prevention, treatment, mental wellness, and emergency preparedness. Traditional knowledge is valuable, but every medical treatment must be tested for safety, correct doses, and effectiveness. Next, BRICS cooperation matters because of its enormous scale. The article estimates that the expanded grouping represents approximately 45% of the world's population. A healthcare solution successfully shared among those countries could benefit billions of the people. The countries also possess different strengths. India has a pharmaceutical manufacturing capacity and digital health platforms. China has invested heavily in health infrastructure. Brazil has experience with a universal public health system. Russia has vaccine development capabilities. South Africa has expertise in infectious disease research. And the Gulf members have strong investments in health technology. This is called complementary strength. Every country contributes something different to solve a common problem. BRICS membership has expanded and descriptions may change. In an examination, use the latest official membership information or the information given in the this video. You can follow, or you can follow our website brainbuzzacademy.com. Next, health diplomacy means uh, health cooperation to improve public health and build trust between the countries. India has several important health diplomacy credentials. During COVID-19, India supplied vaccines to many countries through Vaccine Maitri. Vaccine Maitri. India is also an important producer of generic medicines. Generic medicines usually provide the same therapeutic benefit as broadened as you can take that branded medicines but at a lower price. India's CoWIN platform managed vaccination registration and certification at a very large scale. And Ayushman Bharat also demonstrates how India is attempting to expand primary healthcare and hospitalization protection. Through these initiatives, India presents itself as a provider of affordable products, scalable digital platforms, and healthcare programs for the global south. Can I ask you a question? What is the difference between giving health assistance and practicing health diplomacy? Can you answer in the comment section? Here you can take universal health coverage, or UHC, means that everyone should receive the health services they need without suffering financial hardship. Here, 4 points are important. People must receive the services they need. People must receive the services they need. The services must be of good quality. They must be accessible to everyone. Medical expenses should not push families into poverty. UHC does not necessarily mean that every medical service is completely free. It means essential healthcare should be accessible and financially manageable. UHC is closely connected with the Sustainable Development Goal 3, SDG 3, that is aims to ensure healthy lives and promote well-being for people of all ages. It covers maternal health, child health, communicable diseases, non-communicable diseases, mental health, and healthcare financing. For example, a hospital may exist near a family, but if the family must sell its land to pay the hospital bill, that family does not have proper financial protection under UHC. COVID-19 exposed serious inequalities in the global healthcare. Wealthier countries had greater purchasing power. Many of them booked large quantities of vaccines and treatments in advance. Meanwhile, several lower income countries faced delays and shortages. This is called a structural inequality because the problem comes from the way the global system is organized, where medicines are produced, who owns the technology, who has money to purchase supplies, and who receives them first. BRICS cooperation can address this through local pharmaceutical production, technology transfer, voluntary licensing, and pooled procurement. However, cooperation also faces challenges. Countries may disagree over funding, regulation, quality standards, technology sharing, and national interests. Therefore, BRICS must convert political declarations into practical programs. Here, one important term we have to remember: pharmaceutical equity means fair and affordable access to medicines, vaccines, and diagnostic tools. To write a good answer, begin with the context. So mention the 16th BRICS Health Ministers meeting, India's chairship, and its major priorities. In the main body, explain why BRICS cooperation matters, discuss its large population, common health challenges, and complementary strengths. Then explain how cooperation can reduce global health inequalities. Mention local manufacturing, affordable generic medicines, technology transfer, digital health, and pooled procurement. Use Indian examples such as Vaccine Maitri, CoWIN, the Ayushman Bharat Digital Mission, and Ayushman Bharat. So, a balanced answer must also mention challenges such as differences in national interests, financing, regulation, data privacy, and implementation. Conclude by saying that declarations must be converted into measurable action. Okay, so here there are some useful keywords also you can remember. So global south, pharmaceutical equity, health diplomacy, digital public infrastructure, technology transfer, pooled procurement, and universal healthcare, UHC, and resilient health systems. So that is very important to write a mains answer in UPSC. Here we can go through with 60-second revision. Can you answer this? Let us quickly revise the lesson. Why can one country not handle a pandemic alone? Because diseases cross borders and countries need shared information, research, supplies, and response systems. What are the meeting's priorities? Name any three priorities of the meeting. They include pandemic preparedness, digital health, affordable medicines, traditional medicine, TB, mental wellness, and resilient health systems. How does digital health improve access? It connects patients, doctors, records, and services and can provide remote consultations. What is pharmaceutical equity? It means fair and affordable access to medicines, vaccines, and diagnostic tools. What is UHC? It means receiving needed equality healthcare without financial hardship. What are the examples of India's health diplomacy? Vaccine Maitri, generic medicines, CoWIN, and Ayushman Bharat Digital Mission, and Ayushman Bharat. These are the things that we already discussed. So here the central message is very simple. BRICS has enormous population and capabilities, but cooperation becomes meaningful only when it produces fair healthcare access and measurable results. So I'll give you one question here. The closing question you can answer if you have time in the comment section of this video. Can BRICS become an alternative voice for the global south in global health governance? Give one opportunity and one challenge. Thank you.